All right, we are on page 24 in the lab packet today, looking at the blood vessels. So finishing up the cardiovascular system. So this is the vascular part of the cardiovascular system. So we're going to cover pages 24 and 25 in your lab packet. Just to refresh our memory, remember that arteries, the hard and fast rule about arteries is that they carry blood what direction from the heart or to the heart? Away. Arteries away. They both start with an A. So that's a hard and fast rule, never changes. Arteries carry blood away from the heart. Veins carry blood to the heart. So when we look at models or diagrams in a textbook, to make it easier, the models and the diagrams will make the arteries red because typically they have oxygenated blood in them, and the veins are blue because they typically have deoxygenated blood as that blood has left the tissues and it's going back to the heart. The only exception to those colors is the pulmonary artery. Remember, it leads away from the heart, it leads away from the right ventricle and goes to the lungs to get blood. So the pulmonary artery is always blue, and then after it picks up that blood in the lungs, the pulmonary veins carry blood back to the heart, and that is a red vessel in a model or a diagram, because it's picked up freshly oxygenated blood. And then from there on, all the arteries, are going to continually be red. So just remember that exception to the rule in terms of colors. But blood is never blue. Blood is only red. It's either bright red if it's full of oxygen or dark red if it's low in oxygen. So we do see that, but it's never blue. That's just something we use in textbooks and models, so don't think that that's the case. And when you look at your vessels in your wrist, for example, it looks blue only because the red blood in there is reflecting a blue color as the light strikes the different tissues of your skin. But that blood is not blue, it is red. Okay, so be sure that you teach your children that, because sometimes I hear, if you have kids or relatives or whatever, because I sometimes hear kids come home from elementary school say that my teacher told me that once it hits the air, it turns red. And that's not correct. Blood is only red. Okay, so we're going to start with the arteries. We're going to look all the way down the arterial side of our circulation. Then we're going to go down the venous side, our veins. And there's a lot of similarity. Our major vessels, arteries and veins, lie next to one another because that helps maintain body temperature. Because our blood, houses that body temperature that's provided by the surrounding muscles and overall metabolism. And by keeping those vessels kind of side by side, it makes it less messy for getting to and from the locations, feeding the organs, draining the organs, and also maintains body temperature. So we're just going to go down the artery side, and you'll see a lot of similarities in naming between the arteries and veins. And a lot of these vessels are based on location. So if you know the body part from our, in our body regions and surface anatomy that we studied in Lab 1, you'll see some of those terms come back now as we name these vessels. Also, the vessels change their names as they travel along. So it's still a straight vessel, but as we move to different parts of the body, the vessel changes. You have to be aware of where that starts and ends. Just like our interstates, right? You can be an I-90 and then it turns into 94, right? And if you continue on going all the way south, it changes numbers again, but you might not ever leave that interstate. It's just changing its name as it goes across the country. Same thing with our body. These vessels will change name as we move through the different body parts and regions. So looking at the heart, just refreshing the major vessels that leave the heart on the arterial side. So arteries, we have the pulmonary trunk, which is just the base of this major vessel here, is the pulmonary trunk. And then we have the branches of the two pulmonary arteries. And then they branch again, we can see, to serve the different lobes of the lungs. But pulmonary arteries are those blue vessels that branch left and right. And then, like I said, the pulmonary trunk is that base of the pulmonary artery before it branches left and right. Again, the pulmonary artery is blue. And then if we look at the four vessels that are best seen in the back of the heart, those are the pulmonary veins carrying fresh blood back to the heart. So that's why they're red. So we have the pulmonary vein, these two, and then this one isn't quite shown, but there are two on the back. And the best way to see that is to turn the heart model and look around on the back side. And there are four pulmonary veins, and again, they lead to the left atrium. because the left side of the heart is going to pump that oxygenated blood to the rest of the body. So zeroing in a little closer then, the aorta is this large vessel that ascends upward. So the aorta is the largest vessel in the body as far as muscular. It's a very thick muscular wall, and it comes from the left ventricle, remember, and then it ascends upward. So this portion where it curves upward, we have a special name, and that's the ascending aorta. So the ascending aorta goes upward, and then it comes down and travels behind the heart. And we'll talk about that in a little bit. But remember from lecture, we talked about the coronary circulation, and those coronary arteries start at the base of the aorta. So the coronary arteries are the red vessels over the surface of the heart. Don't forget, those are the arteries. If they're red, coronary arteries supply that heart muscle. And then the ascending aorta branches, and it has 3 branches at the top, and they have different directions that they go to serve the head, neck, and arm. So the first branch is the brachiocephalic artery. So that's this first one, the brachiocephalic. Then the middle one is the common carotid, and that's going to go up the side of the neck. And then the internal one is the subclavian. Okay, so instead we're going to use these flashcard pictures. I think it's a little easier for me to point to and you can see things better. So if you go in our Blackboard folder under flashcards for blood vessels, you'll get these nice pictures. So continuing on then, looking at, like I said, the aorta, the different branches of the aorta, we have the brachiocephalic. Brachio means arm, cephalic means head. So this blood vessel is going to branch, go down the arm and go up the neck into the head. This one is the internal carotid. It's going to go, the common carotid. It's going to go up the right side of the neck. And this is the left subclavian. So that's going to go down and travel underneath the clavicle on the left side. So subclavian, sub means below, clavian refers to the clavicle. So this vessel goes underneath the clavicle. Okay, so then that, like I said, this aorta is going to continue down. So we have the ascending aorta. This is called the aortic arch right here. And then it descends down and goes behind the heart. And you can see here at the bottom is where it comes down after traveling behind the heart. So in this picture, we removed the heart, and we can see that aorta, how it descends downward. So this is a big, thick piping system of, large amounts of blood. So any kind of break in this aorta here as it descends downward is going to be huge blood loss, because every pump of the heart sends a pressure wave into that aorta, and that's where you hear about squirting blood, right? If someone cuts themselves, every time the heart pumps, it's spewing blood. We don't see that coming from veins, because veins don't have that pressure wave from the beating heart. We only see that in arteries. And we don't typically poke into arteries in the healthcare environment unless we're taking a blood gas, an arterial blood gas, typically using the radial artery in the wrist. But we don't typically, we don't put IVs in arteries. We put IVs in veins, again, because it's delivering that medicine back to the heart and then distributing it to the body, right? We wouldn't want to put it in an artery because it's going to go straight to whatever organ is downstream from that artery. So always veins. When we do blood draws or when we do IVs, we're using those veins. So this part of the aorta that is behind the heart but above the diaphragm, we call this the thoracic aorta. So it's up there in the chest, thoracic aorta. And coming off of that are the intercostal arteries. Can you see these small red vessels here? Those are the intercostal arteries coming off of the thoracic aorta. So that just serves the muscles that lie over the ribs for breathing. And then when we get below the diaphragm, we have the abdominal aorta. So the diaphragm is your dividing point between the thoracic aorta and abdominal aorta. And coming off at the top of the abdominal aorta are the phrenic arteries. So there's a pair of those we can see that feeds the diaphragm. So they're up underneath the diaphragm, the phrenic arteries. And then we have this group of vessels here that are going to go and serve the abdominal organs, some of them. And this is called the celiac trunk. So it's a single vessel with multiple branches. So the trunk, we're just having you know the base of that vessel, and it's the celiac trunk. And then from there, that's going to go on and branch to the stomach, the liver, the spleen. But you don't have to know each individual branch. Just know it as the celiac trunk. The next vessel going down is the superior mesenteric artery, and that's that nice thick singular vessel there, and that serves a lot of the digestive tract as well. So that branches to serve most of the small and large intestine. So superior mesenteric. We can compare that to this lower one here, which is the inferior mesenteric. It's all by itself down here at the bottom. Inferior mesenteric, and that serves a smaller portion of the large intestine, like the last part of the bowel. So the superior mesenteric is usually thicker, larger diameter than the inferior mesenteric. So you can tell the difference between them, the two. And also the fact that it's higher up, higher up on the abdominal aorta is why it's superior, and the one down low is inferior. So these are singular vessels coming off more the middle of the abdominal aorta. You have the celiac trunk, superior and inferior mesenteric arteries. Then the other branches you have to know are paired vessels, and that is the renal arteries. So on either side, we have the renal arteries, and these are serving the kidneys, so supplying fresh blood to the kidneys, but also blood that needs to be filtered by the kidneys. So there's waste in these kidneys that need to be filtered. So the renal arteries carry that blood to the kidney. Then on the bottom, we have a thin pair of gonadal arteries, and these go to the gonads. So the gonads are the ovaries, the testes in the outside of the male, and those vessels serve those reproductive organs. So there's a pair, and they're very long and thin. And we have this torso model here that shows those long gonadal arteries that go all the way down to the gonads. So in this diagram, they've been cut short, but we have pictures of models that show them much longer than that. So that's the gonadal arteries. And then that large abdominal aorta will branch and forms the common iliac artery. So iliac, remember, is the large bone of the hip. So right where it passes through at the top here is the common iliac, and then you'll see there's branches coming off here. See the first branch down here? So this name is going to change then as we see this branch. So before it branches, just this portion here and here is the common iliac. After that, the small branch coming down is the internal iliac. So here and here is the internal iliac. Then it branches down to become the external iliac as it passes through the hip. So the external iliac is after that. And this is a common mistake that students make on the lab exam. They see the common iliac, and then they forget to look for that little branch there is the internal iliac, and then they call this the common iliac also, but it's actually the external iliac. So here are those gonadal arteries. It's in the torso model. This very long red vessel here is the left gonadal artery, but the right gonadal artery has been cut short. But you can see how long these vessels are. So we've got the phrenic artery up here, we have the celiac trunk here, we have the superior mesenteric, inferior mesenteric, and then the paired gonadal arteries. And then the renal arteries, the kidney's been removed on this side, but we can see the renal artery here on the right side. All right, so now we're on the top of page 25, looking at the cranial or cerebral circulation. So this is a hugely important circulation because we know our brain needs a good blood supply of oxygen and nutrients to keep us going. And you know, if you get low oxygen or low blood sugar, it affects mental functioning, and people can pass out from that. So need good blood supply here. So I switched over to the PowerPoint that contains the models because these really show this really well, and your textbook does as well, but I really like these models and how they show these vessels. So the common carotid are on the bottom here, these large vessels. Before they branch, we call it the common carotid. Those common carotids come up, and then if we look at a side view, we can see the common carotid here on the bottom. It branches. The thicker vessel here goes inside to serve the brain. So that's the internal carotid. And then the external carotid comes up and serves the surface of the scalp and the skull. So not quite as wide because less blood supply. You know, our hair is important, but to keep us alive, not really. So it's a smaller vessel, but the one that goes inside the brain is much larger. So when you look at the model, you'll see that that's, you know, much wider. So once we get inside the brain then, this is a top view. So we're looking here, now we're just moving in and looking at the top. So this is the front of the skull, this is the back of the skull. We have the vessels that serve the inside. And what happens is, if I look back, one more thing I should point out here, we have the vertebral arteries too that serve that go through the vertebrae of the neck. So the cervical vertebrae were those only vertebrae that had those extra foramen out on the side. That's because of some extra blood supply, the vertebral arteries. So the vertebral arteries come up the side of the neck between the vertebrae. So don't forget about those. Then when we get inside the head, those vertebral arteries come together. So these are the ones that come down that come up the sides of the neck in the vertebrae. They come together to form the basilar artery here. So these are the vertebral arteries, then they come together to form the basilar artery. It kind of looks like a man, doesn't it? It's like, here's the feet, here's the body, here's the funny head with the antenna and these weird little ears, you know. So if you kind of keep that in mind, you can label this. So the vertebral arteries are here, comes together to form the basilar artery. And then branching off from the base, at the end of the basilar artery are the posterior cerebral arteries. So that's here. These are the posterior cerebral arteries coming off the back. So if you find the circle, and you know this is anterior, this is posterior, so these vessels on either side are the posterior cerebral arteries. Then we have that internal carotid artery that I said was real big and comes up inside the brain. That is what is found here. It's not shown in this model, but it comes up and branches left and right to form the middle cerebral arteries. So these two vessels on either side are actually branches of that internal carotid artery that comes up here, but we can't see it. It's been cut and this model doesn't show it. And we're not going to have you know the internal carotid from this view. We're going to have you know it from this view right here, this large thick branch here, right here, and comes up. So middle cerebral arteries here in the middle. So think of it posterior, middle, and then obviously these two would be the what? Anterior cerebral arteries. So that's what those are. And then this connecting vessel that forms a circle right in the middle of all this, and here's the pituitary gland, by the way, but all of this forming a circle, we call the circle of Willis. And that just is that circular portion, kind of the head of this little man that we see in the middle of the cerebral circulation. So you've got the anterior here, middle cerebral arteries here, posterior cerebral arteries here, all connected by the circle of Willis, then the basilar artery, and then the vertebral arteries coming down. And that's your cerebral circulation. So what do we call a clot in the cerebral circulation in one of those cerebral arteries? What do we call that when a blood clot gets stuck in there? Yes?
No, sorry, I was waiting for somebody to walk.
Oh, well, now you're in the hot seat. What do we call a clot in a cerebral artery? Do you know? You guys know this, but maybe you've never thought about it to this depth before. A stroke, yeah, that's a stroke. There's two types of stroke. There's a hemorrhagic stroke, and that is where a blood vessel bursts that serves the brain. That's very serious because you have just huge blood loss over the brain. A clot, sometimes we can get in there and reverse that clot. If we can get in there quick enough and help dissolve that clot with some of our clot busting agents that we have, people can have signs and symptoms of a stroke and we can reverse it completely and restore function and they're fine. It just depends on the size of the clot and how long it's been there. So big thing, if anybody ever has signs or symptoms of stroke, you need to get them in right away. Okay, so that is all of the cranial or cerebral circulation. Now we're going to look at the vessels as they go down the arm. So looking at that brachiocephalic artery here, again, that was that branch off the aorta here. Remember, it went up to become the common carotid and then subclavian. So we've got the axillary artery. So you have to come down here, find the armpit, and that's the axillary artery. So the axillary artery is out here in the armpit. So right about here would be a good place to, be sure that that's going to be the axillary artery because that's where the humerus and the scapula come together to form the armpit. So we have the axillary artery. And then following that down, that becomes the brachial artery. And what do we do here with the brachial artery? What is this important for in healthcare?
Blood pressure.
Yeah, we put our blood pressure cuff around that. We measure pressure and heart rate and mean arterial pressure using that brachial artery. Then it comes down to the radial artery and the ulnar artery. Well, if you know your anatomical position, if we know this is the thumb, this is the pinky, we know the thumb lines up with the radius. So this is the radial artery here. And on the opposite side here would be the ulnar artery. So we know those bones that lie underneath there, so we can predict what the vessel is. So radial artery, ulnar artery. And be sure when you take the lab exam that you write out the word artery and vein. You don't just write radial and forget artery or vein because you'll get half wrong on that. Then we continue down. The abdominal aorta we already did. We got down as far as the external and internal iliac, right? So now we're in the leg and we're looking at the femoral artery. So the femoral artery, if we follow that down, is the large vessel that runs down over the thigh. And the one that goes behind is the, you don't have to know that one, never mind. Okay, so the femoral artery is this large vessel, here, let's follow it here. This is the femoral artery, comes out, comes all the way down, branches. I'm trying to find where it starts. Yeah, it's a little lower down here, so femoral artery. Make sure this is the femur, so femoral artery makes sense, right? That it would be here, femoral artery. Oops. Okay, and then we have the popliteal artery. The popliteal artery is behind the knee. So we get here, down here, behind the knee is the popliteal artery. And then we come down and we have the posterior and anterior tibial artery. So this one isn't shown very well on this picture. We'll have to go back to the flashcards to look at that. You can see it's kind of grayed out, or it's a little fuzzier. So what goes behind the tibia? This would be the posterior tibial artery, and this would be the anterior tibial artery, the one in front that you can see clearly in red. So that's that one. And if we follow that down, we'll see that it comes over the top of the foot. And this is the dorsalis pedis artery. Pedal, like you pedal a bike with your feet. So dorsalis pedis artery. So what's interesting about this artery is we assess this all the time in nursing. My daily assessment when I go in for patients is I measure the radial artery. I just feel for pulses in the wrist, so we know we have good circulation coming down. There's no clots in the arms anywhere. So we feel the wrist, and if we can feel a decent pulse, then we write that down as +2. But if they're weak, then it's +1. And if they're absent, we're in trouble. We have to go get a Doppler and really assess that well. And then we feel the fingertips. Are they normal? Are they warm? Do they have any numbness or tingling? Can they feel my touch? Those are other things you can assess if they have a really weak or non-palpable pulse. And the same thing with the feet. We go on and check that little heartbeat. We feel for that pulse on the top of the foot. So again, if we don't feel anything, sometimes they're so full of fluid, they have edema in the feet, that it's almost impossible to feel these pulses. So if that's the case, you have to go get the Doppler, and that'll get through all that fluid and feel for those pulses. But sometimes it's just impossible, and we have to go by touch and feel and make sure that there's good circulation. Because if there's a blood clot in the leg, that can be really serious. So we always have to feel for those pulses. Did you have a comment or question?
In the book, it says on the top of the foot there's an arcuate artery. Is that just like a different artery that we don't have to worry about?
Right, you don't have to know the arcuate. No, just the list that we have on page 25. So that's the dorsalis pedis artery. And then when we get down into the fetal circulation, we have to remember arteries carry blood away from baby's heart. Veins carry blood to baby's heart. So if this is baby's heart, here's the placenta. So this is what is the separation between mom's blood circulation and baby's blood circulation. So the only thing that can pass through this placenta is whatever's in the plasma. Red blood cells cannot pass from mom to baby. But things like oxygen and nutrients and wastes in the plasma, that can cross the placenta. And we know that there's some drugs that cross the placenta and others that don't, right? For people that have been pregnant or know someone who's been pregnant, there is a consideration there for what we can expose babies to in utero in terms of medications. So if we look at this is carrying fresh oxygenated blood to baby's heart. So what would this red vessel be called? It's going to baby's heart. It's part of the umbilical cord. So of your choices there, an objective. Umbilical vein, yes, because it's carrying blood to baby's heart. So then that is circulated throughout, and then we have this large vessel carrying blood away from baby's heart, coming down, branching, and these are the umbilical arteries. So there's two of those, right? Two of those wrapped around that umbilical vein. So which is more important, do you think, to be functional and open wide and doing its job? The vein or the artery? Because some women have a problem with one of these vessels, and I'll tell you what it is in a minute. Which is more important, do you think, for keeping baby alive? I mean, they're both essential, but if one has a little issue with it, it's okay. So umbilical vein or umbilical artery, what do you think? Which one carries nutrients and oxygen? 50-50 chance. The vein. Veins carry blood to baby's heart, right? Veins, so when we're talking about the umbilical cord, it's all about the baby. So this is the umbilical vein. This is one of those exceptions again, right? Just like the pulmonary artery and pulmonary vein, these are opposite colors that we would expect. So the umbilical vein is red because it's carrying freshly oxygenated blood from mom to baby. So that isn't the most important vessel. We want that to be open and wide and really serving that baby. Now smokers, we know, tend to have smaller babies. And why do they have smaller babies? Because nicotine, the minute nicotine enters the bloodstream, it's a constrictor. It constricts blood vessels. So what does that do to that vessel leading to baby? Constricts it. So there's less flow of oxygen and nutrients to that baby. And with less oxygen and nutrients, babies are smaller. And we've done lots and lots of research, and of course, we know that babies that grow up in smoking households have more problems with lung issues, and because they're just exposed after birth as well. But that blood supply is impaired. So the best thing a woman can do is quit smoking once she finds out she's pregnant to maximize blood supply to that baby. So that's the umbilical vein. The umbilical artery, some women are born with only one umbilical artery. Is it a big deal? Not really. As long as it's open and it's returning that blood from baby back to mother to be excreted by her kidneys, not a problem. And baby has produces urine while it's in utero also. But that's the umbilical vein, umbilical artery. So there's two of those. Then we have these two bypasses. So there's two bypasses. One is called the ductus venosus, and the other one is the ductus arteriosus. So the ductus venosus is here because the umbilical vein bypasses the liver and hooks up right to this major vessel. This is the picture of this, actually, of this circulation is in the fetal chapter. If you want to turn to that, it's in chapter 29 of your textbook. But if you look in your picture, you'll see a picture in your textbook that matches this one. The ductus venosus is right at the level of the liver because it bypasses, because the baby's not eating, so its digestive tract doesn't need to have a separate vessel to pass through the liver because mom's liver has done all the work. So this is the ductus venosus here. And then the ductus arteriosus is up in, let's see, where is it shown here? Well, the ductus arteriosus is a mixture, as a place where the pulmonary artery and pulmonary vein mix their blood because we don't need to send blood to the lungs because baby's not breathing while it's still in utero. So there's this bypass there as well. And I can show you a picture of our fetal circulation model. It's shown a little bit better there. But if it's between two arteries, it's the ductus arteriosus. Between two veins, it's the ductus venosus. And then if we look inside the atria, remember that interatrial septum we looked at last week with the sheep heart and the heart model? There's a hole where there's mixing that occurs between the two chambers, the two atria. Because again, we don't need to separate oxygenated and deoxygenated blood because baby's not breathing yet. All the oxygenated blood is coming in from this umbilical vein. So there can be mixing of blood in the heart that's not going to affect baby. So there's a hole in that, between those atria, called the foramen ovale. And the foramen ovale, again, allows mixing, more efficient blood supply throughout the heart for baby. But after birth, we better make sure that hole closes. So there is a separation between the right and left atrium. So the right atrium is going to pump it to the right ventricle up to the lungs to get oxygenated. The left atrium is going to have oxygenated blood. If that hole is still there, that oxygenated blood that just came back from the lungs to the left atrium will mix with the right atrium, which is deoxygenated, and baby's not going to have good oxygenation when that left ventricle pumps to the aorta. So baby will have a little bit of blue fingertips, a little blueness around the lips, and oxygen levels will be down when we check that after birth. So some babies need to go in and get that repaired. They have a patent, it's called patent, which means open, patent foramen ovale. So they have to get that fixed. Sometimes they close on their own. It's just a small hole. It depends on the amount that's open. So I'll show you a picture of that on our fetal model. Okay, so be sure that you look at that video that I have on the fetal circulation that shows the different parts you need to know for that. Now we'll look at the vein side of things. So if you go back to page 24, on the right column where it says veins, remember that if we had the heart in here, we'd have the superior vena cava, bringing blood from the arm and head. So superior vena cava. And the inferior vena cava leads to that right atrium, bringing blood from the abdominal area. So we have the superior vena cava above the right atrium and inferior vena cava from below. So both of those are veins bringing deoxygenated blood back to the heart to be pumped to the lungs again. So that's the superior vena cava. Then that superior vena cava branches left and right into two brachiocephalic veins. So a little different than the aorta, right? The aorta is what branched the arteries upward to the arm and head. So these are just brachiocephalic, a little easier, left and right brachiocephalic. Then each of those passes underneath the clavicle, we can see here, to form the subclavian vein. The subclavian vein. Sometimes we have what we call central lines in nursing where we give people an IV that we want to put some pretty heavy-duty meds in. So like if someone's having bypass surgery, we'll give them what's called a multi-med line, and they'll insert that in the side of the neck, and the tip of that catheter sometimes is right into that subclavian vein to put that medicine real close to the heart. And so we're not wasting any time. We're not worried about collapsing veins down in the wrist and the arm. When we're serious about giving lots of meds and lots of fluids for someone who's going to be more at risk for issues, we like to put a bigger catheter, larger diameter catheter. And so that's what we use multi-med lines for, or central lines. So that's the brachiocephalic subclavian. So then we continue down and look at the inferior vena cava. So this lies right alongside what artery is here in this region? All the way down, lying parallel to this large vessel. So we have the inferior vena cava lying right next to the, what's the red vessel we find here? Because we don't, that's one thing I don't like about textbooks is they pull these vessels out separate and you don't see them together. That's what's nice about the model. You can see those vessels together. What is the large vessel in the abdomen called? Yeah, abdominal aorta. So you have the inferior vena cava lying right next to the abdominal aorta. And when you look at these in the cadaver, they're not blue and red. So how are you going to distinguish a vein from an artery? Well, arteries have thick muscular walls. So that's going to be your clue. So when I look at an artery in the cadaver, it's going to stand upright and away from the body in that cadaver. It's not going to be flat and thin. A vein is going to be flat and thin. It's going to be wider. It's going to have a larger diameter, but it's going to be flat laying in that cadaver because it does not have as thick a muscular wall. The aorta, down the aorta, is going to be kind of round looking, almost like a hose in there. Okay, so the inferior vena cava. Then we have the vessels that come off to serve the liver. So that's what these are, the hepatic veins here at the top that are going to serve the different lobes of the liver. So there's 4 of those. And then the renal veins, just like the renal arteries, are draining the blood from the kidneys. So the kidneys have filtered this blood, so we have clean blood coming back from the renal veins. It's deoxygenated, but it's still cleaned out from whatever is going to be metabolized by those kidneys. Then the gonadal veins. So we have the right gonadal vein that comes right along down off the inferior vena cava, just like the gonadal arteries came off, long, thin vessels going to the testes or ovaries. But look at where the left gonadal vein is. This is kind of interesting. It's a branch off of the renal vein. So the left gonadal vein is a little odd, and then it comes off of that renal vein. Why that is, I don't know. Somebody had a little mutation probably years ago, and that was passed down the line, and now we see that coming off of there. And I'll tell you, I taught a comparative anatomy class at Viterbo one semester, and they were dissecting cats, and they had to know all the blood vessels in the cat. And I was going crazy. These were all grad students that were going into professional programs, so they needed an A in this class, and they were to qualify for their programs and be competitive. So they were taking this very seriously. And these cats, what I learned is there's so much individual variation of blood vessels. Everybody had their hand up. And I was going from desk to desk to desk as I can't find my internal carotid, or I can't find this vessel or that vessel. And some were coming off of other vessels. I mean, it was crazy, the individual variation of how our vasculature is. Some people were missing some vessels, some had an extra one. It was just incredible. So when a thoracic surgeon goes in to do surgery, over the vasculature of the chest cavity or in the abdominal region, whatever, he never knows what he's going to discover once he gets in there. He has to kind of know the basic layout, and some of these vessels that are branches can be variable. Maybe you've heard of people that have, poor blood supply to a kidney. Have you heard of that? Where the renal vein or renal arteries aren't operating like they should, or they only have, portion of one. So I know some people that struggle with that. So there is a lot of variation with some of these vessels. So there's a good example. That's the left gonadal vein. Then again, this inferior vena cava branches right at the level of the hip over the ilium to form the common iliac vein. Then it branches, just like we said, in the arterial side. So we have the internal iliac vein, external iliac vein coming down, just like we saw with the arteries. Then if we continue down into the, or can you go back up, sorry, to the head, here's the superior vena cava. Remember, it branches into the left and right brachiocephalic. Well, that brachiocephalic, again, branches to the subclavian vein here. But then we have the internal and external jugular. So here's the internal jugular. Again, look at how large it is, because it's draining blood from the brain. So that's the larger one, shown number one here, and then number two is the external jugular vein, which drains the blood over the scalp and skull. So when we're like, we kill a deer, right? Don't you hang it upside down by its back legs, and you cut the neck and drain all the blood, right, from that animal through the large external jugular, internal jugular, sorry. All right, then we go to the arm. We have here at the armpit, which is labeled number 1, we have the axillary vein. So that's in the armpit. Then we have the brachial vein that comes out over the bicep region, right? So that's the brachial vein, right, lying right near that brachial artery. And then we have the cephalic vein. So this is actually the cephalic vein and the brachial vein are a little different. I want to make sure I describe this correctly to you here. Let's see. Yeah, the brachial vein is the one that comes down. They're both branches of that subclavian vein, but the one that comes out over the outside of the arm, this is the cephalic vein. So the cephalic vein comes out over the outside of the arm. And then the brachial vein comes down kind of off of that axillary vein. So here's the axillary vein. As we get beyond that, that's the brachial vein. It's the middle one. Do we have to know the basilic also? No. So then you have the cephalic on the outside, brachial on the inside. So the cephalic vein, if we follow that around to the outside, we can see that that connects with this inner vessel that you don't have to know, but it comes across the inside of the elbow, and this is the median cubital vein. The median cubital vein. So if we follow that cephalic vein down the outside here, the median cubital vein connects to that. So it's the inside of the elbow. What do we use this for? Take a look at the inside of your elbow. Do you delight the phlebotomist when you go in for a doctor's appointment, or do they say, oh no? If you have a nice blue vessel right at the surface, then they're happy to see that because you're an easy poke. You're an easy person to give a quick IV if you're in the ER and you're bleeding out. They can give you, they don't usually like to use that for giving blood, but they can at least give you some fluids quickly through the vessel if it's right at the surface. If you look there and it's not at the surface, then you're a harder poke and they're going to have to look elsewhere. So we do blood draws at the median cubital vein. We can give IVs in a hurry. It's not ideal to give someone an IV right in the inside of the elbow because they're going to, kind of block off the flow if they bend that elbow, but sometimes it's our only choice. So that's the median cubital vein. Then we continue down the leg. So again, we have the common iliac vein, then the internal iliac vein, external iliac vein coming out, and then right over the femur is the femoral vein. So that's what's shown in number 2 here is the femoral vein. And this vein that comes down the back of the leg and comes kind of unbranched all the way down. There are branches to it though, but in the model and the diagrams it's not branched. This is the great saphenous vein. And what this causes trouble for is branches of the great saphenous vein come out near the surface of the back of the thigh and contribute to varicose veins. If you've heard of varicose veins, that's due to leaky valves in veins where blood doesn't return to the heart. It kind of backflows and then bulges that vein out a little bit. You see those lumps on the back of people's legs. That's varicose veins, and oftentimes those are branches of the great saphenous vein. So they can sometimes get rid of those through surgery and not impair blood flow because the great saphenous vein is still draining blood from the leg and returning it to the heart, but those branches are not working well, so it sometimes helps people feel better and have more energy in their legs if they can get rid of some of those serious varicose or varicosities in those superficial veins. So that is the blood, those are the blood vessels you need to know. Make sure you, again, say artery and vein. Use these flashcards, and it would be helpful probably to color the vessels, because if you're printing them off in black and white, you can't see blue versus red. Because in the models that we have, in the diagrams, you'll see blue versus red, except for the cadaver. And Deke will take you in to show you the cadaver. Otherwise, if this is an online class, obviously we're not going to have you look at the cadaver in real time, but there'll be pictures.